Cases of both COVID-19 and the flu are ticking up across Canada, and in response, some officials have suggested bringing back mask mandates. The concern is that an already strained healthcare system just won't be able to handle a new surge of outbreaks. Joining us this morning is infectious disease specialist Dr. Abdu Sharkawi. Welcome back to your morning. Good to see you.
Good morning.
What kind of a situation, first of all, are you seeing on the front lines right now?
Well, it's pretty bad. I think anyone who has been to an emergency room anywhere, frankly, across Canada, but particularly here in Ontario, or has been to a children's hospital knows that the situation is quite dire. There's a lot of sick people in waiting rooms and filling the emergency room, specifically with respiratory viruses. And it's not just COVID-19. There's a lot of RSV. Influenza is picking up. And there's a lot of other viruses that we haven't been able to identify. And I think in large part, it's because people are not wearing masks. And there's this sense of we're behind, COVID is behind us and we don't need to worry about this anymore. And so we do away with everything that has kept us safe from all kinds of respiratory viruses in the last few years. And I think that's really coming at a significant cost.
Given what you're seeing and experiencing, where do you stand on mask mandates, and what about other restrictions like distancing?
Well, I think I've been quite vocal since March when I thought that, getting rid of mask mandates was not a great idea. I thought it was premature. And I thought that psychologically was going to send a message to people that COVID is gone. And we've clearly seen that that is not the case. I try not to think about it as a restriction. I try to think about this as something that we should all do to try and protect ourselves. When you see emergency rooms full of babies that are extremely sick and people who are being treated in a waiting room, I think it speaks volumes about where we are right now. In terms of distancing, I think we want to do away with the idea of distancing and just really understand that it's ventilation that's key. So use HEPA filters, crack open windows, try and do as much as you can outdoors. But we know that this is an airborne virus. So, 6 feet apart is no longer a dogma that makes any sense. Just trying to make the air and the environment around you a lot cleaner and a lot safer. And you can do that too.
It's an interesting reframe, Dr. Sharkawi, thinking of it as a preventative measure as opposed to restriction. That might help a lot of people. Pfizer and Moderna's new bivalent vaccines target the different BA Omicron subvariants, but it's the cases from the BQ.1 and the BQ.1.1 that are growing fastest in some areas. So what do we know about the effectiveness of bivalent vaccines on these newer subvariants?
We still don't know, but I think if we look back at the history of these vaccines as they've evolved over the last year, they tend to retain their efficacy against even the more resistant strains, at least in terms of preventing serious disease. So it's important to make sure that we understand that, they're still going to prevent you from being in hospital and very, very sick if you take them and you're up to date. But the important thing is they can't prevent all infections, and that means that milder infections can still occur, which means they can still spread to other people who may not be as well endowed in terms of their immune system and their underlying health. And that's why things like masking and rapid testing and avoiding interaction with others when you're sick and keeping the air in your environment as clean as possible are so important, because the vaccines can't do the job all by themselves.
Last note on the vaccines, they provide protection, we understand, for about a 6-month period. And while 84% of eligible Canadians receive those first 2 doses, only 18% have received a shot within the last 6 months. How vulnerable does that leave us as we head into winter?
Yeah, I think it's a problem. I mean, I've personally seen people who have been vaccinated last in February and March, and they're quite sick in the hospital, especially if they're elderly or if they've got underlying disease conditions. So it's important not just to think that we've licked this. There's still a lot of time left here to put our stamp and put our foot on the snake here, and really take care of ourselves. So get caught up. The scariest things now should be the ghoulish costumes and displays outside of people's homes. They shouldn't be thinking about what our emergency rooms are going to be like in the next couple of weeks.
I can see the concern on your face. Good to have you with us this morning, Dr. Sharkawi. Thank you.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.